Welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
And I'm Dr. Brad Wiening.
What do we got today, Brad?
So today's episode is an interesting one. We have a patient who was kind enough to wear a recording device during his motorcycle accident.
So we've got video footage of the injury. I love that. I love it when you can see the mechanism of injury.
I saw him in the clinic and he's like, hey, do you want to see how it happened? And I was like, yeah.
Okay.
So he was kind enough to share the video with us, so we're going to show it and get people to maybe guess what got broken.
Yeah, while you're watching the video, try and guess what broke. Have you ever ridden a motorcycle?
Yes.
Really?
Yep. Growing up out west, we used to ride dirt bikes all the time. I suffered multiple concussions. Back when concussions didn't seem to be a big deal, but...
Were you wearing a helmet?
Yeah, but knocked right out before.
I double rided on once on the back.
Okay.
Yep. Apparently I put the helmet on backwards, so I didn't look the part. But yeah, that's the only time. I guess I'm scared to ride them after doing our trauma rotation and
now I'm scared I don't ride them
seeing
anymore.
all the motorcycle injuries. But I guess you could say that about cars too. But
Sure.
personal preference, I guess. Okay, well let's go. Let's
Take a look at the video evidence. Here we are going down the California highway.
Looks like a nice sunny day, Brad.
Clean, dry roads.
A few clouds.
A little dirt on the side here.
Oh, he's coming in hot.
Uh-oh.
Where'd the road go, Brad? I think he hurts himself right there.
Okay, so here we are looking at the clavicle. Paul, what do you see?
I see a broken clavicle, big time.
So this is from the motorcycle accident. This was one of his injuries, and this is at the 2-week mark. So what you can see is actually that there are multiple pieces and sharp ends, but in general, the clavicle is not grossly shortened, but there are a bunch of pieces.
Wow, okay, let's go to the OR and fix this.
No, so that would be one of the options. So there's always operative and non-operative choices for clavicle fractures.
Okay.
One of the main indications for surgery is shortening greater than 2 centimeters, but we felt that this was not indicated for him. After a long discussion, he chose non-operative treatment. So what we can see is here's at 2 weeks, and then here's at 6 weeks. It's hard to see a significant change at 6 weeks, but you can see there's a little bit of a shadow. What happens is your bone bleeds, and it makes kind of a scar tissue, and then that slowly gets converted over to bone. This patient actually was using a bone stimulator to help encourage faster bone healing. And then at 8 weeks, you can see here, especially if we change the intensity, you can see the outline, and you can palpate it actually on his skin like a knuckle of growing bone. And this was moving as a unit. As he moved his shoulder, I could not feel any crepitus or movement at the site of the fracture. He had almost no pain and actually had returned to work a month before because he was self-employed.
You know what? I'm impressed that this is the only thing that he broke with that motorcycle accident we saw. That is impressive. And the other thing to mention is that this is a controversial area because certainly there are some surgeons who say, oh yeah, you have to operate on that, let's get him to the OR right away and fix that.
Yep.
But certainly our practice is to try and treat as many of these non-operatively as possible and let the body heal it on its own. And then if it doesn't heal, you can talk about surgical intervention. But certainly a valid way of treating this would be to go to the operating room right away, put a line it up, and get it to heal that way too. So 2 ways to treat this fracture. We're just showing you one non-operative way to treat the clavicle fracture.
Perfect.
Check out our video on clavicle fractures. We've made one of those in the past, and hope you enjoyed it.
And if you like this video, like us on YouTube and subscribe to our channel.
Yeah, or check it out on Instagram. If you're watching it on YouTube, check it out on Instagram. If you're watching it on Instagram, check it out on YouTube. Thanks. See you later.
See you next time.